Your doctor reviews your blood work and tells you everything looks fine, and they mean it, based on what the tests they ordered can actually show. But here is something most people in that waiting room never learn. The standard panel used at a routine physical in America consistently overlooks 5 blood markers that are among the most reliable predictors of serious health crises in older adults. The American Diabetes Association estimates that 96 million Americans currently have prediabetes. 80% of them are completely unaware, not because they skip doctor visits, but because the right test was simply never ordered. A landmark study tracking more than 1,000 adults through the Framingham Heart Study found that people with elevated levels of one specific amino acid in their blood had nearly twice the risk of developing Alzheimer's disease years down the line. That test is almost never part of a standard panel. Today, I will give you the exact names of 5 blood tests, the specific numbers you need to look for on your results, and the precise words to use with your doctor if they are hesitant to order them. I'm Dr. Thomas, and this channel exists for one reason: to give adults over 60 clear, evidence-based health information that your physician often does not have time to fully explain. If this is your first visit, subscribe now so you never miss a video that could genuinely affect your health. Let's go through these 5 tests, starting with the first one, because it could mean the difference between catching a problem early and facing it at full force. Test 1. Hemoglobin A1C. The first test is called hemoglobin A1C. Many of you have had a standard fasting glucose test at some point. That test captures a single measurement of your blood sugar at one moment in time, typically first thing in the morning. The limitation is that blood sugar shifts constantly throughout the day, so a single reading can appear completely normal even when something damaging has been quietly building for years. The A1C works differently. It measures your average blood sugar level over the previous 3 months by examining how much glucose has bonded to your red blood cells. Think of it as the difference between a single weather photograph and a full seasonal weather report. One shows you what happened on one afternoon. The other reveals what has genuinely been happening over time. Here is why this test matters for every senior watching. Prediabetes, defined as an A1C between 5.7% and 6.4%, accelerates the silent damage that high blood sugar causes well before any formal diagnosis is made. It harms the small blood vessels supplying your kidneys. It damages the capillaries behind your eyes. And research from the University of California, San Francisco, published in 2021, found that prediabetes speeds up cognitive decline in older adults at nearly twice the rate of normal aging. Your target is an A1C below 5.7%. If your result falls between 5.7 and 6.4, you are in the prediabetes range, and that number calls for a serious discussion with your physician without delay. If your doctor only orders a fasting glucose test, ask specifically for the hemoglobin A1C by name. They are 2 separate tests, and one provides far more useful information. Do you know your current A1C number? Drop it in the comments right now. I want to see what seniors across the country are actually dealing with, and it helps everyone watching feel less alone in this. Test 2. 25-hydroxyvitamin D. The second test is 25-hydroxyvitamin D, and it is widely misunderstood. Vitamin D is commonly referred to as a vitamin, but inside the body it functions more like a hormone, actively involved in regulating over 200 different cellular processes. According to the National Institutes of Health, more than 41% of American adults are deficient, and that rate rises considerably after age 65 for a straightforward reason. As the body ages, the skin loses much of its capacity to produce vitamin D from sunlight, and most seniors spend the majority of their time indoors. That combination creates an ideal condition for deficiency that most standard panels never identify. A major review published in the New England Journal of Medicine in 2022 linked vitamin D deficiency in adults over 60 to a 25% higher risk of bone fractures, a 19% increased rate of cardiovascular events, and a meaningfully accelerated pace of dementia development. These are not minor statistics. They are figures that should shape how seriously we approach this test. Here is the part most doctors do not explain, and it is the detail that matters most. The majority of labs consider anything above 20 nanograms per milliliter to be within normal range. However, the Endocrine Society recommends that older adults maintain levels between 40 and 60 nanograms per milliliter for optimal bone, brain, and immune health. There is a real gap between what the lab considers acceptable and what research considers optimal, and that gap has a direct impact on daily quality of life. Eleanor was 68 when she came in reporting persistent fatigue, aching joints, and a gradual mental fogginess that had developed over the previous 2 years. Her standard blood panels had been completed twice during that period, and both times the results came back unremarkable. When we specifically ordered a 25-hydroxyvitamin D test, her level was 12 nanograms per milliliter, severely deficient. Within 5 months of supervised supplementation, her joint discomfort had reduced significantly, and she described feeling mentally clearer than she had in years. For seniors, this is not an unusual story. It is one of the most consistently correctable deficiencies I encounter in practice. Test 3. High Sensitivity CRP. The third test is called HS-CRP, which stands for High Sensitivity C-reactive protein. This test directly measures systemic inflammation in the body. And if there is one word that explains why seniors develop heart disease, Alzheimer's disease, and certain cancers, that word is inflammation. Chronic, low-grade inflammation works silently through your tissues for years, sometimes decades, before producing a formal diagnosis. The HS-CRP test can detect that process while it is still early enough to act on. A landmark study from Harvard Medical School that tracked more than 27,000 women found that HS-CRP was a stronger, independent predictor of future heart attacks than LDL cholesterol, the number most physicians spend years carefully monitoring. Yet HS-CRP is rarely included in a routine panel without a specific request. What brought this marker into sharp focus for me was research from Johns Hopkins showing that adults over 65 with chronically elevated HS-CRP were significantly more likely to develop mild cognitive impairment within a 5 to 7 year period. The inflammation gradually damaging your arteries is the same inflammation degrading your brain tissue. These are not two separate problems with separate names. They are the same underlying process. Your target is an HS-CRP below 1.0 mg per liter. A result between 1.0 and 3.0 represents moderate cardiovascular risk. Anything above 3.0 is considered high risk and warrants prompt evaluation. When speaking with your doctor, ask specifically for the high sensitivity version of this test, not a standard CRP, because only the high sensitivity version can detect the subtle elevations that a standard test would miss entirely. Test 4. TSH. Thyroid stimulating hormone. The fourth test is TSH, or thyroid stimulating hormone. The American Thyroid Association estimates that 1 in 5 adults over the age of 60 has some degree of thyroid dysfunction that is either undiagnosed or inadequately managed. Your thyroid regulates your metabolic rate, energy production, body temperature, mood, heart rhythm, and bowel function. When it slows down, every connected system slows along with it. The symptoms of an underactive thyroid, fatigue, unexplained weight gain, sensitivity to cold, constipation, depression, and persistent mental fogginess, so closely mirror what both doctors and patients tend to attribute to normal aging that the condition goes undetected for years in people who are quietly struggling with it. The standard laboratory reference range for TSH extends up to 4.5 milli-international units per liter. However, a growing body of research and an increasing number of geriatric specialists suggest that optimal function in older adults requires TSH to fall between 0.4 and 2.5. Many physicians will review a result of 3.8, note that it falls within the reference range, and tell you your thyroid looks fine. Technically, by laboratory standards, they are correct. But there is a meaningful distinction between falling within an acceptable range and actually functioning well. Comment below if you have ever been told your thyroid appears normal, but you still feel consistently drained or mentally unclear. I genuinely want to know how many people watching are living with this right now. Test 5. Homocysteine. The fifth test is homocysteine, and this is the one that most urgently needs to become a standard part of every senior's annual blood work. Homocysteine is an amino acid that accumulates in the blood when the body is deficient in B vitamins, specifically B6, B12, and folate. As it builds up, it becomes directly toxic to blood vessels and brain tissue. The original Framingham Heart Study, published in the New England Journal of Medicine, followed more than 1,000 adults with an average age of 76 and found that those with homocysteine levels above 14 micromoles per liter had nearly double the risk of developing Alzheimer's disease. A 2021 international consensus statement from Alzheimer's researchers across multiple institutions formally concluded that elevated plasma homocysteine is a modifiable risk factor for cognitive decline and Alzheimer's disease in older adults. The word modifiable is the critical one here. This is a risk factor you can actually do something about. There is additional evidence worth noting. The VitaCog trial, a randomized controlled study from Oxford University, found that B vitamin supplementation aimed at reducing homocysteine slowed the rate of brain shrinkage in participants with mild cognitive impairment by 30% over 2 years compared to placebo. Among participants with the highest homocysteine levels at the start of the trial, brain atrophy was reduced by 53% relative to the placebo group. These are not minor findings. They are intervention results that should be driving routine homocysteine testing in every senior's annual panel. Your target homocysteine level is below 10 micromoles per liter. A result between 10 and 15 is considered moderately elevated. Anything above 15 is significantly elevated and requires prompt attention and treatment. Frank was 76 when his family brought him in, increasingly concerned about his memory lapses and growing difficulty finding words, a pattern that had been worsening for roughly 2 years. His standard labs showed nothing of concern. His homocysteine level was 19.2 micromoles per liter. We began a targeted B vitamin protocol using methylfolate and methylcobalamin, the forms most effectively absorbed by older adults. 8 months later, his homocysteine had dropped to 8.7, and his daughter told me during a follow-up visit that his conversation and memory recall had noticeably improved. I do not make guarantees about individual outcomes, but I will say this clearly. This is a test every senior deserves to receive. Action steps. Here is exactly what to do before your next appointment. Write down the following 5 test names and bring that list with you. Hemoglobin A1C, 25-hydroxyvitamin D, high-sensitivity CRP, TSH, homocysteine. Tell your doctor you would like all 5 added to your next blood draw. If insurance coverage is a concern, ask about direct out-of-pocket pricing through Quest Diagnostics or LabCorp, because many of these tests cost between $15 and $40 when ordered independently. That is a modest expense relative to what can go undetected without them. If your vitamin D result comes back below 40 nanograms per milliliter, discuss supplementation with your physician. A common starting point for seniors is 2,000 to 4,000 IU of vitamin D3 daily, taken with a fat-containing meal, since vitamin D is fat-soluble and absorbs more effectively that way. If your homocysteine is elevated, ask specifically about a B-complex supplement containing methylfolate and methylcobalamin rather than standard folic acid and cyanocobalamin, which older adults often absorb poorly. As always, consult your physician before beginning any supplementation, particularly if you take blood thinners, kidney medications, or thyroid hormone therapy, as interactions are possible and need to be individually evaluated. Closing your body sends signals long before a crisis arrives. These 5 blood tests are how you learn to read them. You do not have to wait for a heart attack to discover that inflammation has been building for years. You do not have to accept cognitive decline as an unavoidable part of aging when elevated homocysteine can be addressed in months with the appropriate B vitamins. The information is available. The tests exist. You simply need to ask for them by name. Comment one of 3 things below right now. Write "getting tested" if you plan to request these 5 tests at your next appointment. Write your age and which tests you have already had done so we can see what seniors nationally are actually receiving from their doctors. Or write "sharing this" if you are sending this video to a family member or friend who needs to see it. If this information was useful to you, please subscribe. Next week, I will be covering 7 commonly prescribed medications that new research links to accelerated memory loss in adults over 60, a video you will not want to miss. I'm Dr. Thomas. Take care of yourself, because no one in that exam room advocates for your health more effectively than you do.